I'm Dr. Sam Goldhaber, President of NATF, and I'd like to talk with you today about a public health crisis. And this is the failure to take appropriate measures to prevent stroke in people who are stricken with atrial fibrillation. Atrial fibrillation affects up to 3 million Americans, and atrial fibrillation is the most preventable cause of stroke. Overall, about 15% of strokes are caused by atrial fibrillation, but among individuals who are in their 80s or 90s, about 30% of strokes are due to AF. And we have effective ways to markedly reduce the risk of stroke, and this is with anticoagulation. We have the anticoagulant that's been with us since 1954, warfarin, which has the trade name Coumadin, and now within the past 3 years the FDA has approved 3 novel oral anticoagulants: dabigatran, also known as Pradaxa, rivaroxaban, also known as Xarelto, and most recently, in the last week of December 2012, apixaban, also known as Eliquis. These novel oral anticoagulants are administered in a fixed dose. There is no need ever to do laboratory coagulation monitoring. And these novel oral anticoagulants have virtually no drug-food interactions. In particular, one can eat green leafy vegetables and binge on them one day and have none the next day without any effect on the anticoagulant level. From a medical point of view, all 3 of these novel oral anticoagulants have about a 50% lower risk of the type of bleeding problem that we fear the most, which is bleeding into the brain. So this is a true medical advance. And some of these novel oral anticoagulants are actually superior to warfarin and have a more powerful stroke reduction risk than warfarin as well. One of them actually reduces all-cause mortality compared with warfarin. So the times are changing. We have more options than ever. But the sad news is that the population that we should be protecting, about 40% of individuals are not getting any anticoagulant whatsoever. This was true 1 decade ago in a European study. It was true a few years ago in an American study, and it's true today in a global international registry called Garfield. Our job, whether we're clinicians or members of the public or patients or family of patients or friends, is to advocate to make sure that the common sense guidelines that have been established by professional organizations are followed, so that patients are assessed for their stroke risk, and that when they should get prophylaxed and helped to reduce stroke risk with anticoagulants, that those anticoagulants are prescribed. So stay in touch with us. NATF provides many opportunities for you to become involved in education, outreach, and advocacy.